Hi everyone, my name is Samantha Harte and I'm a doctor of physical therapy. One of my favorite things to do is bust myths about the body. Mythbuster number 2 is that crunches will help my low back pain. Okay, so the thing about crunches is that they can be really effective for strengthening the superficial abdominal wall. If you have a condition like arthritis or stenosis, where it feels really good to gap the vertebrae and create space between the bones, crunches might be exactly what you need. However, if you have a problem like a disc injury in the low back, crunches could exacerbate your pain and make things worse. So the place I like to start, because it's the safest and it's often the most undertrained, is in the deep abdominal wall. So if you peel away all the superficial abs, the ones that give you a six-pack and that look really nice in a bathing suit, and you go way in towards the spine, you have two really important muscle groups that often are undertrained and people don't even know how to turn them on. A simple way to use your breath to get those muscles activated is to inhale through your nose, which helps to kick your diaphragm in, so you want to make sure your belly fills with air on the inhale, right? And then on the exhale, draw the belly button intentionally in towards your spine, like it's connected and sewed together without moving the position of your lower back. And see if you can hold the contraction all the way up to 1 minute. You might only have 5 seconds in the beginning, but then you practice a little bit every day until your stamina improves. Hi, my name is Samantha Harte. I'm a doctor of physical therapy and the owner of Strong Heart Fitness in Santa Monica, California. We are on the mat to go over 3 initial exercises to help bust the myth that crunches will alleviate your low back pain. They are exercises that will actually turn on your deep core stabilizers at a very low level to start building the muscular support to help control your low back pain from the inside out. If you want more dynamic exercise, it's coming later, but you have to be able to hold each of these exercises for 1 minute first.
From the neutral spine position, which you may need to find again if you think you lost it, you're going to brace your abdominals again. Holding on to that contraction, you're going to squeeze your glutes to press the hips up from the mat, creating a nice flat line so there's no crease in the hip and no excessive arch in your low back. And hold both your core and your glutes and rest. If you came out of neutral spine, you're going to find it again, rocking the spine back and forth till you get into the middle. You're going to engage your abdominals like you did on the first exercise, and then squeeze the glutes to press the hips all the way up, creating a nice flat line in the front of the body. No extra arching of your back, and hold. And slowly release. The last exercise in the sequence is the most demanding. You're going to be on your belly and you're going to stack the elbow right underneath the shoulder joint for best stability. And you're going to lift your body up away from the mat, drawing the chin in, spreading the shoulder blades, and then the hips come up. Watch out as you get tired for the belly falling down, the upper body sinking. Lift back up, pull everything in, and hold. Remember that you want to hold for 1 minute before we move on to something more dynamic.